If only an apple a day could really keep the doctor away. Instead, hundreds of KU students go to Watkins to meet their needs. But some LGBT students find that a little more difficult. Now Watkins is trying to make a more comfortable environment for LGBT students by updating medical record procedures and safe zone training.
According to LGBT leader and graduate student Michael Detmer, the changed medical record procedures will help meet the needs of the LGBT community.
So in terms of medical records, I think this is going to impact transgender students, the T out of the LGBT, the most, because they are the ones who maybe look differently than their assigned sex at birth, or they actually have gone through a sex change and they appear differently. So clinicians or doctors aren't looking at paperwork and wondering why this person doesn't look like Sarah and they look like a Steve.
According to CampusPride.com, KU has a 4.5 out of 5 stars for LGBT-friendly policy, programs, and practices.
For example, when you would walk in to a doctor's office, or anywhere really, there are 2 check boxes, male or female. As I'm sure you can probably understand, that's not really accommodating for individuals that are gender variant. So what the options are going to be now is that it's going to ask gender at birth and gender currently, and how an individual would like to be known as or referred to as male or female.
Updated medical records will improve the care for LGBT students by giving medical professionals full disclosure of a student's information in a safe environment.
This will really help, because one of the concerns that we always get on that assessment is, how come you keep asking me if I'm male or female? Okay, that's important to a medical history. It's as important to me what gender a person was born with as if they had a tonsillectomy at age 4. There are things I need to know from that.
This is Kathleen Smith for College Healthy Habits.